Hello everyone. Today we discuss summative exam blueprinting in a course for Foundations of Clinical Medicine. Our objectives for today's session are listed here. As a prerequisite for today's session, you need to have your assessment plan ready to use. You can review the assessment plan template here for how to complete an assessment plan, but make sure you have this material before we begin the session. We're going to begin by looking at the definition of exam blueprinting. Here's an example of an actual course exam blueprint. This blueprint includes 6 major columns: clinical presentation, learning objectives, clinical tasks, and competency level column, as well as a weight calculation column and number of items column. They are aligned to each row. To complete the blueprint, you first review your course or module assessment plan to find the clinical presentations that will be tested in the midterm or final exam. Then fill the clinical presentation into the clinical presentation column. For example, you may want to remove some topics that have already been tested in an assignment or midterm exam. Topics of basic science can be embedded in their associated clinical presentations. In relation to these clinical presentations, you then pick up the learning objectives in the assessment plan that will be tested in the exam. And again, as in the other things, you use the numbers, not the actual text for the learning objectives. Once you have this information, in the third column, you estimate the percentage of the clinical tasks that are expected for the student to perform. So in the second step, you're going to review those learning objectives again, and then think about what competency levels would be used in each item of clinical presentation. The 3 that we're going to look at specifically here are knowledge, application, and problem solving. So in this example, you can see that in some of the objectives, the knowledge is higher or lower than application and problem solving. The third step is to calculate the weight for clinical presentations. This involves impact and frequency. Take some time to read very closely the instructions at the beginning of this section. Thank you. So here we are at the last step. This is where you calculate the number of items you're going to put on a test. So, again, read the instructions carefully and take a look at the example. If you have trouble understanding what it is you're expected to do, make sure you talk to the assessment specialist. Here's your opportunity to practice what you learned from this session. Take out your assessment plan in a course that you teach and make an exam blueprint. Thank you.